One of the reasons it's so vital to have your children checked with chiropractic during their developmental phases is that the consequences of not correcting problems as early as possible can have a permanent effect, that it has a structural change or deformity in the body. And I'll show you what I mean with a couple pictures and an example that would be relatively common, which is a vehicle accident. So if the child is not yet full grown, and they're still growing commonly up to, say, 14 to 18 years old for females or males, and let's just say that that child is in a car accident for whatever reason, clearly a trauma to the body, and commonly a whiplash type of trauma in that case. When the spine has an injury like that and becomes misaligned, commonly with a change in the normal curvature of the neck, gets off, commonly with a forward bend and or a sideways tilt, either of those things would be common. That child's spine still has to grow. And if there's some part of it that is structurally changed, that as the spine continues to lengthen with growth, it's going to develop curvatures or changes underneath in compensation for that. So commonly that neck will be hurt and the neck will change. And then if you would look at the rest of the spine, it may then develop sideways curves to it, commonly called scoliosis. Now, there may be many factors in scoliosis. I read there's some genetic predisposition when parents have it, and there may be factors that are unknown or not agreed upon or not controllable. But the traumatic things are somewhat correctable or controllable. So if somebody has a vehicle accident and they have a change to their spine, to the extent that that could be repaired or minimized, can certainly have that child can have a better outcome or less of a developmental deformity in the rest of those years until they reach full height. So in that uh, age range, while kids are growing, if they're having falls, tumbles down steps, vehicle accidents, sports related things, those are times to have the kids checked, not so much because of the pain, because they'll quickly, quickly feel better. It's not so much about the pain, it's about trying to ensure normal development as much as possible and to minimize abnormal development and long-term consequences, again, as much as possible.